Your support helps us bring you programs you love. Go to wyomingpbs.org, click on Support, and become a sustaining member or an annual member. It's easy and secure. Thank you.
Aging in Wyoming can be challenging, to say the least. We're living longer, younger family members are moving away, and long-term care is expensive. We visit with Representative Sue Wilson, AARP Director Sam Shumway, and Emily Loos of LIV Health and discuss the sometimes difficult issue of aging in Wyoming and related policy issues facing lawmakers. It's all next on Wyoming Chronicle.
Funding for this program is made possible in part by the Wyoming Humanities Council, helping Wyoming take a closer look at life through the humanities, thinkwy.org, and by the members of the Wyoming PBS Foundation. Thank you for your support.
I'm Sam Shumway, State Director for AARP Wyoming. I've been with AARP for about 4 years. I'm in my 4th year. Prior to that, I worked as an attorney in the state of Wyoming and did a few other things. But AARP is an organization, we're a membership organization with a social mission, and our membership is people who are 50 and older in the state. And so we have around 83,000 members in the state of Wyoming. And these are people, it's interesting when we talk about our membership, there's a spectrum of people in different places in their lives. They're all in this place of at least thinking about what the next chapter is or in that transition place. And there are members who are currently at the peak of their career, who are still working, who are very engaged in their communities, and we have members who are retired, who are planning to travel, who are starting new businesses, who are giving back to their community. And then on the other end of that spectrum, some of our members are dealing with health challenges, are dealing with financial challenges, who are trying to figure out how they're going to pay for their prescription drugs. We have members who are really dealing with some difficulties, some challenges that come along with aging. And so as an organization, AARP is an organization, we want to be relevant and we want to be a resource to that aging population, to our membership, to the 50 plus. Well, one of the big issues that we're seeing with aging in Wyoming is people want to stay in their homes. They don't want to go into a nursing home, they don't want to go into another long-term care setting. And that can be a challenge, and there are a lot of reasons for that. The state of Wyoming has a vested interest in people staying in their homes. Right now, about 63% of all nursing homes in Wyoming are paid for by the state of Wyoming through the state's Medicaid system. And it's a very, home care, home services are about half or less the cost of a nursing home stay. And so there's a vested interest in the state and in these individuals in staying in their homes. And so as an organization, we are working to increase support and funding for these home service providers. We're seeing this increase in the demand for these home services, but we're not seeing a commensurate increase in funding. And we know there are lots of challenges in Wyoming around funding. We know that there aren't a lot of dollars to be had. But the return on investment in keeping people in their homes is very real. And so that's something that we work really hard on in supporting programs and funding for home services. Wyoming is a frontier state. We're a rural state, we're a frontier state. And so even in our more urban areas, if you will, there are challenges around transportation. There are challenges, whether that's public transportation or paid for transportation. There are challenges with access to healthcare. We don't have a lot, we have a shortage of CNAs, certified nursing assistants that provide some of that in-home care. But when you look at another big challenge for Wyoming is isolation. And we look at the health impacts, and when I talk about isolation, this is not just necessarily somebody who's stuck in their home. It's somebody who doesn't have contacts, social contacts with the outside world. And they've studied this, and there's some real negative impacts that come with social isolation. And so what can we do to connect people? And as an organization, we're working on a program to identify people who are socially isolated and connect them with resources, connect them with their community, connect them with senior centers around the state so that they're not just stuck in their homes, or they're not stuck in a place where they don't have any contact with the outside world. But that's not a problem unique to rural Wyoming. That's not a problem unique to Basin or Baggs or some of these smaller communities. It's a problem in Cheyenne and Casper. One of the things I want to mention when we talk about some of the challenges that we have in Wyoming that are somewhat unique to Wyoming is a real shortage of home health providers. When we talk to these folks who provide in-home care, this is keeping people in their homes. What we hear is, yes, we need more money, we need to support these programs, but really there's a workforce issue in Wyoming. We don't have enough people who are willing to do these CNA jobs, and these are low-wage jobs, they're difficult jobs, and we just simply, the workforce isn't there. So one of the things that we're talking about as an organization, and we're working with the legislature, is in Wyoming right now, we have about 70,000 caregivers. These are unpaid caregivers. These are family members, neighbors who are taking care of a loved one or a family member. How can we support those? And those people, those caregivers, are helping these people stay in their homes. They're not getting paid for it, but they are incredibly important in providing bathing and chores and meal prep and those kinds of things that help people stay in their homes. How can we, as a state, do a better job of supporting those 70,000 caregivers? And there are some other states who have done some things that are kind of innovative. People are always looking for more information about these issues and issues that are important to them as they age. Our Facebook page, AARP Wyoming's Facebook page, is a great resource to go and see the things that are happening in your community and throughout the state. We will also give updates through the legislative session on progress on some of these issues that are so important. But most importantly, I would say talk to your legislator. Give them a call. Say, I want to make sure that I can age in my home. And if there are things that you can do as a policymaker, please have my best interests in mind as you're working on these important issues.
And as we begin our discussion on aging in Wyoming, we want to set the stage. We want to understand the problem, and we want to understand some potential policies that might impact the problem. And that's why Representative Sue Wilson, the chairman of the House Labor, Health, and Social Services Committee, is with us today. Chairman Wilson, welcome.
Thanks for having me. It's great to be here.
This is such an important issue in Wyoming. Wyoming, first of all, it's not getting any younger. What do you know about how Wyoming's aging?
Well, first I want to just say one thing which occurred to me when you said the problem of aging. That's a good thing in a way that we're not dying young. So let's just say that.
I'll view that as a positive
That's
as
right.
well.
There's a
Absolutely.
positive there. We should start with something positive. But there's really three parts to the challenges, and one is, as you said, that we're living longer, which is good, but we're also living longer with more chronic diseases, with more obesity. So the people who are living longer are having more physical challenges that they need to deal with. Then the second challenge that we're facing is that the younger people are moving away from Wyoming, whether for economic reasons or education or whatever. But so that means the workforce to take care of the elderly people is shrinking.
And the family support that might be in place normally
really key.
is shrinking out.
And then a third part is just that all of this care is very expensive. You're all aware of our financial picture in the state, and nearly 2/3 of the nursing home and long-term care is paid for with public dollars. So, and people are not saving really enough money to solve that problem on their own. So all three of those are problematic altogether.
In fact, it's so important, this became your committee's top priority.
That was one of so Management Council assigned us the challenge of aging Wyoming, and then also behavioral health, mental health, substance abuse type problems. So I've been kind of joking that I'm not sure if I can solve those problems by January. So everything that we're going to do along those lines is just small steps. What can we do? Chip away at workforce, chip away at funding, chip away at healthcare. and setting aside the mental health, but just because we're talking about
Sure.
aging, and things that people can do themselves. There's so many components, and we just need to take it a step at a time and see if we can make it better.
There's a couple statistics that really jump out at me that you mentioned earlier, that people don't save. Mm-hmm. And in fact, the statistics that I've read is where the average working age household had $2,500 saved for retirement in our country, and perhaps it's a little more, a little less in Wyoming. But my goodness, that just doesn't at all begin to cover any cost of long-term care.
No, if you look at the private pay rate for nursing home care, if you were, in poor enough health that you had to be in a nursing home, the private pay rate is about $88,000 a year. And so I think the statistic shows that people who are 65 or between 55 and 65 now have $15,000 saved for retirement. But that's still, what is that, about
Sure.
3 months worth
Right.
at that type of rate. So I think, leading on to where we get a little bit further in the interview is that if you can stay out of the nursing home, maybe your $15,000 or $3,000 will go a lot farther
Sure.
if you can stay home rather than in an institution.
And I want to let our viewers know we're going to talk with a provider here in just a little bit in this show that has some ideas and solutions and is working to do exactly that. And it's just key for this issue. The other big issue from a legislature's perspective must be the potential impact of $250 to $300 million a year to the state's budget by 2030. Do you subscribe to those numbers, and are you fearful that that is going to be just almost unmanageable?
I think so. Right now, we're spending about $65 million a year just in general fund from the Medicaid program and other long-term care services, and so variously, whether it doubles roughly or just increases by 50%, but that's certainly a big increase no matter what we do to it. And we all know what the revenue picture is and the other things that we're trying to spend our money on, like education, and we've got corrections. I mean, there's just a lot of people expenditures. So I think it's a very realistic, the calculation had, of course, some variance in it, the potential, but you can't realistically look at it and say, well, it's just going to stay flat or it's going to get less. I mean, that's obviously not going to happen that way.
So here we come to policy decisions then. What can the legislature do to mitigate that number? What's going through your mind?
Right. Well, so interestingly, something that we did back in 2013 when I was first in the legislature was very helpful. There used to be a cap on the program for home and community-based care. So they put a maximum number of people that could be served out of their home, but there was no cap on the nursing home side. So people couldn't get care under the home care, so they ended up in a nursing home where they were more expensive and maybe didn't want to be there in the first place.
And not what you wanted.
No,
for sure.
I don't know how the cap got there, but in 2013 we removed the cap. So that was just a simple change and enabled a lot more people to receive services in their home instead of in a nursing home. So that was one good thing. There's a lot of other areas that we're looking at, working on. Some require legislative action, some don't. The Department of Health is looking at just changing their rules so that you don't need to have an RN on staff all the time in an assisted living facility. If you could have them just be there during the daytime or, 12, 16 hours instead of 24/7, the staffing costs would be less and the facilities would be more affordable. So that's something that they are maybe doing just by rule change. A couple of other things that we're looking at, we still need to assess and determine how they would play out financially. But there's some other states have expanded the ability of what they call self-directed care for home-based care. So in other words, you wouldn't only have to hire an agency to do some sort of service for you, but you could, and we do this a little bit with the population of people with disabilities, you could maybe pay your daughter-in-law to drive you, say, from Thermopolis to Casper. Or
for a medical visit or something, whatever you needed to do.
For non-medical transportation, for just chores around the home, take you to the grocery store. There are a lot of things that people need. Maybe you're not driving anymore, maybe the weather is bad and you're worried about falling and you want someone to take you. And if we could expand our waiver a bit so that those services could be paid for. Another area, so adult foster homes. We set up a couple of years ago a program trying to have so people didn't have to move into, not everyone wants to live in their daughter-in-law's basement, let's say, but if you could have foster homes, but it was set up fairly restrictively. You had to have a certain number of people, and of course you had to have the ADA accessible bathroom, and a lot of regulations, and so that really never took off. But if someone could take in their uncle and his friend, and they were able to receive some rent type money for caring for them in their home, that's another area that we might look at. So there's a lot of possible options. You just want to make sure that you're not just throwing money at things and then they don't actually work, or they don't serve that many people. I think you mentioned before we started recording, just the issue of if you're in town like Cheyenne or Casper, there are agencies. But if you're out in the really rural area, it's just a little harder to access these services. And I often joke that from the federal government's perspective, even when they try to do something for rural areas, their idea of rural is Manassas. And I don't know if you've ever been back in DC, but Manassas is probably as much population as half the state of Wyoming already. I mean, but from the Potomac, they think that's rural, and they don't know.
It's not a rural town of 6,000 for sure,
no,
or even less. Representative Wilson, thank you so much for setting the stage now. And now we want to look at a Wyoming provider who is doing a good job in allowing people to stay in their home. That's next. Stay with us. And as we continue learning about issues affecting the aging population in Wyoming, we wanted to take a look at really a unique program, LIV Health here in Cheyenne. And Emily Loos, the CEO and founder of LIV Health, welcome to Wyoming Chronicle.
Thank you.
We appreciate your being here. And Debbie Matlis, you're a client of LIV Health.
I am.
Welcome also.
Thank you.
Emily, tell me, you were a social worker, and yet you branched out to really provide some unique services that are available to folks primarily in Southeast Wyoming, but also assist them in staying at home longer. What is LIV Health?
LIV Health is what I like to call a boots-on-the-ground organization. We provide both case management and behavioral health treatment to individuals in the community, home and community-based settings. So we might go into nursing facilities, assisted living facilities, patients' residences. We've even met people at the library. So really that network of social workers and behavioral health clinicians and case managers that can reach people that are unable to get into a facility, that don't have transportation, things like that.
It seems to me what you do is assist seniors in the mountain of
Yes.
bureaucratic challenges
Yes.
that are in front of them, and really make that an easy proposition to get services that they need while they're in their home.
Yeah, I think it's hard for people to navigate the system that it is now. The system is so much larger now than it was even a decade ago, and everything requires an application now, and it's different. You know, it used to be you go in, you talk to someone, they fill out a page, and that gets you started on a number of things. And now there's just hundreds of different programs and resources. I mean, I hear all the time about people wanting to put together a resource guide, because even the case managers and the people entering the field don't know what's available. And so it's enabling individuals to be, you know, we're the experts and we're the ones that can help them navigate that system and get all of the paperwork filled out, all of the requirements met for each specific program.
You were telling me earlier off camera about why you started LIV Health, and I think that's an important story. You were a social worker 15, 16 years ago.
Yes. And I still am. And I think, you know, one of the things that was really hard was when patients were coming back into the hospital for something like food, clothing, shelter, those immediate needs. They were having a hard time. You know, they'd go home from such a traumatic event and have no one to help them. And there are great home health agencies, and sometimes those individuals were eligible for those services, and sometimes they weren't. And so people would come back into the hospital trying to figure out how to get their medications, how to get food, and it was hard to not have anywhere to send them, you know, not to not be able to give them a solution.
Debbie, you're a client
Yes.
of LIV Health. What does LIV Health mean to you?
Ooh, I enjoy LIV Health because if I need something, Jen, my caseworker, or Courtney, my counselor, are there to provide the help for me.
And what sort of things do they help you with?
Paperwork. Courtney is, like I said, my counselor. She comes to my home. And even if I don't have something major to talk about, we sit and visit. And that is nice. Just to have somebody come to my home and just say, hey, how you doing? Because not a lot of people ask that question.
And do you feel they've been able to allow you to have more independence in your life?
Yes, yes, most definitely.
So what other services do they help you with? And when you talk about like paperwork, what type of paperwork?
Medicaid, housing, those type of things. Finding food banks, that kind of stuff too. Because being a senior, we don't get a lot of help. So knowing it's there has been a big help.
And they provide you almost with a roadmap of
Yes,
directions
yes,
and assistance.
Yes.
Interesting. So, Emily, even though you're located here in Southeast Wyoming, you have taken calls from all over the state. What happens when someone, say, from Lander or elsewhere, calls your office here?
Yeah, so a big part of what we do really is advocacy, and we are sometimes the voice for individuals. And so it could be that we are getting on the internet and Googling and looking to see what's available in their area so that we can make that call and get them connected with someone. It could be that we're helping them through the phone, through telemedicine, through the mail, you know, helping them as best we can from where we are with the tools that they have.
And I think that's an important distinction because it isn't the case that a senior needs to be a computer expert or a tech expert to utilize your services. In fact, most of your clients probably aren't.
Yeah, sometimes it's just a phone number. You know, a lot of people don't always know what Medicaid offers, what Medicare offers, how to even go about getting that. Could it be something that they can access through their primary care doctor? Could it be, you know, getting the support from a neighbor? We have an incredible power in the communities and that we live in, just based on the support of friends and family and neighbors. And I think, you know, maybe it's just making a phone call to the local local churches are another great resource because they always have people that are willing to help out. And so it could be we're calling a church and asking them to help provide transportation to someone. It could be calling the library. Like I said, you know, you just don't even think about some of these places as being a resource for an aged individual. But people are always most of the time, very generous and willing to help out. And so, yeah, sometimes it's just a phone call.
Debbie, her company used to be a company of one, and now there are 30 employees.
27.
27 employees in your company. You're growing, but there are still challenges to your expansion.
Yes.
What are those challenges?
Well, I think recruiting, you know, like I said before, is a huge challenge for us. And I think in Wyoming, we're facing a crisis of not only having a shortage of CNAs, but having a shortage of a skilled workforce.
Emily, we were talking off camera, and something really struck me, that it is challenging for you at times to recruit and retain good employees, even though a social worker, for example, who graduates from the University of Wyoming can make $20,000 a year more working for you and have their student loans repaid, yet they want to go to maybe Fort Collins or Denver for bigger city amenities. How big of a challenge is that for you?
It's a huge challenge. I think it's something that over the last 3 years has gotten even worse. People just want those really fun amenities. You know, younger families, they want meal delivery, they want pubs, they want places that they can go and hang out. And I think Cheyenne is working toward that. getting that, but it's years away. And so I think having those things that really incentivize people wanting to stay in the community.
Younger folks.
Yes, younger folks in the community to stay.
And if Cheyenne is getting there, I would argue that maybe other parts of Wyoming are even farther behind, which is a hurdle to retain younger folks.
Yeah.
Deb, I want to end our conversation with you. How did you first get in touch with LIV Health? How did that process work?
I am not a United States citizen.
Okay.
And every 10 years, I have to redo my visa. And I needed help with that, and I did not know where to turn to. And I believe I looked it up or something and found the number, because I had called different agencies, but nobody knew. And I got in touch with LIV Health, and they directed me where I needed to go. And from that is, I now have a caseworker and a counselor.
And that caseworker was then able to say, hey, how else can we help? Is that right?
Absolutely, yeah.
Well, Debbie, I appreciate your time
you.
with us this morning. Thank you for coming in on short notice, actually.
You're welcome.
And we appreciate that. And Emily, congratulations to you and your work.
Thank you.
Best wishes. This isn't available all over Wyoming, but other communities could follow your lead, I think.
Yeah, absolutely. Thank you for having me.
Thank you for joining us on Wyoming Chronicle.
Thank you.
Funding for this program is made possible in part by the Wyoming Humanities Council, helping Wyoming take a closer look at life through the humanities, thinkwhy.org, and by the members of the Wyoming PBS Foundation. Thank you for your support.